Let's see an NCLEX RN video on assessment of endocrine function. To know about the endocrine function, you need to know about different glands and the hormones secreted by them. Hypothalamus secretes corticotropin releasing hormone, gonadotropin releasing hormone, that is GnRH, growth hormone releasing hormone GHRH, growth hormone inhibiting hormone GHIH, thyrotropin releasing hormone TRH, prolactin inhibiting hormone. The anterior pituitary releases adrenocorticotropic hormone, that is ACTH, FSH, LH, growth hormone, thyroid stimulating hormone, prolactin, melanocyte stimulating hormone. Posterior pituitary secretes vasopressin or ADH antidiuretic hormone and oxytocin. The adrenal cortex releases glucocorticoids, that is cortisol, and mineralocorticoids, that is aldosterone. Adrenal medulla releases catecholamines, that is epinephrine and norepinephrine. Thyroid gland releases T3, triiodothyronine, T4, thyroxine, and thyrocalcitonin, which is calcitonin. Parathyroid gland releases parathyroid hormone. Ovaries releases estrogen and progesterone. Testes release testosterone, and pancreas releases insulin and glucagon. So you need to have an understanding of the glands and the hormones secreted by them. Which statement by a patient diagnosed with a primary thyroid disorder indicates the need for further teaching? Having a brain tumor is so scary. My thyroid gland is not working. Now I understand why the nurse keeps measuring my neck. My energy level may be affected by this disorder. So this is a primary thyroid disorder and the patient is not understanding certain things. The patient needs further teaching. A primary disorder of thyroid function is caused by a malfunction of the thyroid gland. Secondary thyroid disorders are related to the malfunction of the anterior pituitary gland, and tertiary disorders are related to hypothalamic malfunction. The patient with brain tumors may have tumor growth either in the pituitary gland, that can be called a secondary one, or in the hypothalamus, which can be called a tertiary. So in primary disorders there are no tumors. So having a brain tumor is so scary is the wrong option. The nurse correlate an increase in secretion of cortisol to an increase in the release of which of the following hormones? Growth hormone, epinephrine, corticotropin releasing hormone, adrenocorticotropic hormone. ACTH or adrenocorticotropic hormone increases the secretion of glucocorticoids and mineralocorticoids, and cortisol is the primary glucocorticoid. Growth hormone is controlled by secretion of growth hormone releasing hormone and growth hormone inhibiting hormone from the anterior pituitary gland. Epinephrine is released from the adrenal medulla. Corticotropin releasing hormone secretion is from the hypothalamus and it increases the release of adrenocorticotropic hormone from the anterior pituitary gland. The nurse correlate which effects to the stimulation of alpha receptors: increased heart rate, vasoconstriction, bronchial relaxation, pupil dilation, increased gastrointestinal motility. Here you need to know about receptors and receptor sites. Catecholamines, that is epinephrine and norepinephrine, are secreted from the adrenal medulla when stimulated by the sympathetic nervous system, and their actions vary according to the receptor sites. There are mainly two types of receptors, alpha and beta receptors. Alpha receptors are again divided into alpha 1 and alpha 2, and beta receptors are classified into beta 1, beta 2 and beta 3. These alpha receptors lead to vasoconstriction, also pupil dilation, increased pincher tone, increased sweating and increased gluconeogenesis. Stimulation of beta-1 increases heart rate and stimulation of beta-2 leads to bronchial dilation. Gastric motility is influenced by beta receptors. So here alpha receptors result in vasoconstriction and pupil dilation. In caring of a patient with elevated secretion of triiodothyronine and thyroxine, the nurse assesses for which findings? Increased heart rate, increased gastric motility, increased cholesterol, increased urine output, increased respiratory rate. So here, actions of the thyroid hormones triiodothyronine and thyroxine leads to increased heart rate, increased gastric motility, increased respiratory rate, as well as overall increase in the metabolic activity. These hormones also decrease the production of cholesterol and phospholipid, not increase. It decreases. Urinary output is more related to release of antidiuretic hormone. The nurse assesses for which of the following in patient with hypersecretion of parathyroid hormone. Increased serum sodium, increased serum glucose, increased serum calcium, increased serum potassium. Parathyroid hormone increases serum calcium by increasing the bone reabsorption of calcium in the kidneys and activation of vitamin D, which increases intestinal reabsorption of calcium. The nurse correlates an increase in the secretion of which hormone as a result of the release of TRH. The triiodothyronine T3, thyroxine, thyroid stimulating hormone, thyrocalcitonin. Thyroid stimulating hormone is released from the anterior pituitary gland in response to the secretion of thyroid releasing hormone from the hypothalamus. T3, thyroxine and thyrocalcitonin are released from the thyroid gland. Which hormones are released from the posterior pituitary gland? Aldosterone, antidiuretic hormone, follicle stimulating hormone, luteinizing hormone, oxytocin. Antidiuretic hormone and oxytocin, they are released from the posterior pituitary gland. Aldosterone is secreted from the adrenal cortex. The anterior pituitary gland secretes two gonadotropins, follicle stimulating hormone and luteinizing hormone that have major role in female and male reproductive functions. Increased secretion of antidiuretic hormone result in which action? Decreased urine output, increased urine output, decreased serum potassium, increased serum potassium. Secretion of antidiuretic hormone result in decreased urine output. A lack of antidiuretic hormone leads to increase in urinary output. Mineralocorticoids and glucocorticoids lead to excretion of potassium in the kidneys. In order to better locate the isthmus of the thyroid gland in preparation for palpation, the nurse asks the patient to perform which action? Say a, touch your chin to your chest, look at the ceiling, swallow a sip of water. The nurse uses palpation to assess the thyroid gland. The thyroid gland may be best palpated by standing behind the patient. The thumbs of both hands are placed on the back of the neck and the fingers are curved to the front of the neck on either side of trachea. The patient is asked to swallow a sip of water, and the nurse locates the isthmus by feeling it rise when the patient swallows. A patient is undergoing a stimulation test to assess adrenal function. After the administration of cortisol, which laboratory result indicates normal function? Decreased blood glucose, decreased serum sodium, decreased serum potassium, decreased serum calcium. Cortisol leads to increased reabsorption of sodium and excretion of potassium. So there will be decreased serum potassium. Cortisol also leads to increased serum glucose. Calcium is primarily controlled by parathormone from the parathyroid gland. The nurse correlates which finding to age-related changes of endocrine system in a 55-year-old female. Breast enlargement, decreased libido, increased sweating, vaginal dryness, insomnia. Changes in release of the reproductive hormone may lead to problems with sexual functioning, including erectile dysfunction in men and decreased libido in women. Bone density decreases, thinning and drying of the skin, and perineal and vaginal dryness are all associated with advancing age. Decreased metabolism is associated with decreased appetite, susceptibility to cold intolerance, changes in quality of sleep, that is insomnia, and decreased resting pulse rate and BP. So age-related changes of endocrine system include decreased libido, vaginal dryness, and insomnia in females. Johnson, a 27-year-old female experiencing insomnia, restlessness, and irritability for the past several months. During the initial interview, she describes that sometimes she feels as if her heart is racing and has noticed palpitation. She has also noted 8-pound weight loss over the last month despite an increased appetite and food intake. The nurse practitioner completes a detailed history and physical examination. Because of her symptoms of restlessness, irritability and anxiety, along with tachycardia and palpitations, an evaluation of thyroid function is started. The nurse assesses vital signs and finds her heart rate to be 134 beats per minute and her blood pressure 130/80 mmHg. The nurse practitioner arranges for blood to be drawn for T3, T4 and TSH. The nurse practitioner begins a workup for thyroid dysfunction for Johnson. On the basis of her clinical presentation, hyperthyroidism is suspected. The laboratory results reveal increased levels of T3 and T4 with decreased levels of TSH. A tentative diagnosis of primary hyperthyroidism is made and is referred for further evaluation and treatment. In assessing a patient with alteration in thyroid function, the nurse must understand that thyroid releasing hormone release is from which structure? Hypothalamus, anterior pituitary gland, posterior pituitary gland, thyroid gland. Thyroid function is controlled through the coordinated activities of the hypothalamus that secretes the thyroid releasing hormone, which in turn act on the anterior pituitary. Which clinical manifestation observed in Ms. Johnson does the nurse correlate to elevated levels of thyroid hormone? Lethargy, insomnia, dry skin, constipation. Ms. Johnson has an acceleration of metabolism which can lead to hyperexcitability and insomnia. Lethargy, dry skin and constipation are associated with hypothyroidism secondary to decreased metabolic rate. Which thyroid hormone value does the nurse correlate to primary hyperthyroidism? Elevated TRH, elevated TSH, elevated T3, elevated thyrocalcitonin. Because primary hyperthyroidism is an excess secretion of thyroid hormone, both T3 and T4 levels are elevated. In hyperthyroidism, primary hyperthyroidism especially, both TRH and TSH are decreased due to elevated thyroid hormones. Thyrocalcitonin secretion is based upon serum calcium levels. The nurse recognizes that the negative feedback system causes which change secondary to increased T3 and T4. Increased TRH, decreased TSH, increased parathormone, decreased thyrocalcitonin. With elevated circulating levels of thyroid hormones, that is T3 and T4, the hypothalamus decreases the secretion of thyroid releasing hormone and the anterior pituitary gland decreases the secretion of thyroid stimulating hormone. Parathormone is secreted by the parathyroid gland when serum calcium levels are low. Thyrocalcitonin secretion from the thyroid gland increases or decreases based upon serum calcium level. So here, because of the negative feedback system, we can say when T3 and T4 increases, automatically because of the negative feedback system, there will be a decrease in TSH. In a patient with a secondary disorder of the thyroid gland, the nurse assesses for changes in function in which structure? Thyroid gland, hypothalamus, posterior pituitary gland, anterior pituitary gland. Primary endocrine disorders involve the endocrine glands. For example, here thyroid gland. Secondary disorders result from the malfunction of the anterior pituitary gland. The question is asking secondary disorder. Secondary disorder is related to the anterior pituitary gland, and tertiary disorders result from the malfunction of the hypothalamus. The posterior pituitary gland secretes antidiuretic hormone or vasopressin and oxytocin. So in this question, the secondary disorder is asked, that is related to the anterior pituitary gland. If it was primary, directly the gland, and if it is tertiary, it is hypothalamus. Now let's see different tests for endocrine disorders and the normal range. The calcium normal value is 8.2 to 10.2 mg per dl. Ionized calcium 4.6 to 5.3 mg per dl. Cortisol in the morning it is 5 to 25 micrograms per dl, and afternoon it is less 3 to 16 microgram per dl. Glucose 65 to 99 mg per deciliter, magnesium 1.6 to 2.6 mg per dl, phosphorus 2.5 to 4.5 mg per dl, potassium 3.5 to 5 milliequivalents per liter, sodium 135 to 145 milliequivalents per liter, free T3 2.6 to 4.8 picograms per ml, total T3 70 to 204 nanogram per deciliter, free T4 0.8 to 1.5 nanogram per deciliter, total T4 0.6 to 12 microgram per deciliter, TSH 0.5 to 8.9 micro international units per ml. Urine specific gravity is 1.005 to 1.030. Vitamin D is 20 to 100 nanogram per deciliter. So you need to know about this normal values also when you are learning about the endocrine disorders. Hope you understood this video. Thank you so much. Please do keep listening.